Every expecting mother knows her body is going to go through some pretty big changes. The growing baby bump, the motherly glow, the swollen ankles. Then there are changes that new moms might not be expecting, like the possibility of developing a condition called gestational diabetes. Yes, it is a form of diabetes, but it's one that only occurs in pregnancy because the cause of gestational diabetes is literally tied to the pregnancy. It's the developing placenta.
The placenta makes hormones that block the effectiveness of insulin to maintain a normal blood sugar. As the placenta grows during the pregnancy, it makes more of these hormones. What insulin does is it allows the sugar in your blood to enter a cell. If you have a high blood sugar due to not enough insulin, it's called starvation in the midst of plenty. The cells are starving because the sugar in their blood can't enter the cell. Normally, the pancreas that produces insulin can increase the amount of insulin it makes during the pregnancy and maintain a normal blood sugar. But in about 3 to 5% of the pregnant population, the pancreas is unable to make enough extra insulin to overcome the resistance to insulin that is produced by the placenta. But what they found is that even with normal patients with no risk factors, a segment of that population still develop gestational diabetes. So our recommendations now are really to screen every mother for gestational diabetes. The way that the screening test is done is in a normal pregnancy, usually between 24 to 28 weeks, which, if you remember, a full pregnancy is 40 weeks. But at that segment, a woman comes in for a gestational diabetes test.
There are 2 steps to confirming a diagnosis of gestational diabetes. The first screening is called the glucose challenge test, which analyzes a woman's blood sugars 1 hour after she drinks a half dose of glucose cola. If her blood sugars are too high, she's scheduled for a second test.
The further testing that's done is called the 3-hour glucose tolerance test. You then go to a laboratory, not having eaten or drink from the night before, and they will then draw your blood for a fasting test. They then give you your glucose, and then 1 hour after taking the glucose, 2 hours after taking the glucose, and 3 hours after taking the glucose, they then draw blood samples. The fasting blood sugar should be under 95. The 1 hour test after taking the glucose should be under 180. The 2 hour test should be under 155, and the 3 hour test should be under 140. If 2 of the 4 samples are abnormal, you then have a diagnosis of gestational diabetes.
The next step is to control the woman's blood sugars for the rest of the pregnancy. This will prevent the complications of gestational diabetes. These complications are a large baby weight, which increases the risk of internal or fetal trauma, as well as the need for cesarean section, and preeclampsia, a condition related to high blood pressure.
Regular exercise has its own effect of lowering your blood sugar. Exercising allows blood sugar to enter the cells, regardless of your insulin level. So we recommend regular exercise. Vigorous walking would be one. For dietary changes in pregnancy, what we do is we ask you to have foods that do not raise your blood sugar rapidly. And there's a term called glycemic index for foods. These are foods that are rated on how rapidly your blood sugar goes up after you eat them. For instance, if you eat pure glucose, your blood sugar rapidly goes up. Let's say, and you ate 100 calories of pure glucose. But let's suppose you ate 100 calories worth of a piece of chicken. Even though it's the same 100 calories, we have to take time to metabolize the chicken into glucose, and that takes a longer time. And therefore, you don't have a burst of sugar entering your bloodstream, but a small trickle. Therefore, your blood sugar doesn't rapidly rise. And if it doesn't rapidly rise, you don't have to produce extra insulin for the pancreas. In gestational diabetes, that pancreas that makes the insulin is already compromised. It can't make enough. So if you help it along by eating foods that don't raise your blood sugar rapidly, that would be helpful. If those don't work, then one moves on to drugs like insulin, and sometimes the new oral hypoglycemic medications.
There is a risk for developing type 2 diabetes after having gestational diabetes, so women are tested for that condition around 6 to 8 weeks after delivery, and then regularly every 2 to 3 years after that. Gestational diabetes ends when the pregnancy does. It's just one more reason to count down the days until that bundle of joy is finally in your arms. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.